Welcome, fellow humans! Today I want to talk about sleep apnea. I know this is a really common issue that a lot of people have, but I want to discuss a few of the things about it that I think are a little less commonly known. A while ago, I had a doctor suggest that I might benefit from a sleep lab because I have a lot of health problems that include unrefreshing sleep and fatigue and cognitive losses, and poor sleep can affect everything about health. So it seemed like a good thing to check. My partner was convinced that this was not a problem for me because he said, "You don't snore and you don't stop breathing in your sleep." So he didn't think that I could have sleep apnea. But I ended up getting a sleep lab done, and it was really uncomfortable. I had so many problems trying to sleep in the lab that I got a little under 2 hours of sleep. They also said that they would kick you out of the lab at 6 a.m. no matter how much sleep you had or hadn't gotten. And given that I have delayed sleep phase syndrome, where I go to bed really, really late at night normally, I'm usually going to sleep after midnight and I'm trying to sleep in the lab, it was just a disaster. But I got a little bit of data back, and that data had no REM sleep and no deep sleep, but it did have some light sleep, and it had 0 apneas. And while the note from the sleep doctor felt that this was inconclusive, my general practitioner felt that since there were no apneas, that it would be worth pursuing a sleep problem further and that we should look into other health issues. But I started thinking about it a lot, and I realized just how bad my sleep is. Maybe I didn't have classic obstructive sleep apnea, but maybe I had something that was worth looking into, because I needed to be in bed for around 11 hours to feel sufficiently rested. And that's just not normal. I had real difficulty falling asleep, and while I kind of felt like I was able to stay asleep at the time, I woke up exhausted and unrefreshed. So I started researching, is there something like sleep apnea that isn't sleep apnea? And I found that there is. There is a possibility that you aren't actually getting apnea events, but that as an apnea starts to form, your body will react to it by waking you up enough to prevent the apnea. So you don't get any apneas, but you get very disrupted sleep because of the attempted apneas. And I thought to myself, maybe that's what I have. Maybe I don't get actual apneas, but my sleep is being disrupted and inefficient because my body is able to prevent them. So I found a sleep lab that is actually able to test for that. And it was a bit inconvenient, but my family was able to help me out with transportation and such. So I got a referral, and they ran a little device up my nose and down my throat that would stay in there while I slept to measure this. And they hooked me up, and they had a much better policy where they said, you can sleep in the lab until you are ready to get up. You signal us when you do at whatever time you do. And so I was able to get a fairly decent amount of time in the sleep lab recording my sleep. And it turned out I had classic obstructive sleep apnea. Just the typical kind, didn't need the special thing up my nose, and I just needed more data. The one thing that was interesting about it was that I only had apnea events during REM sleep. From what I've read, this is believed to be more common with women, although of course it could happen to anyone. And so my other phases of sleep were not being disrupted by sleep apnea. And in order for me to have enough apnea events to qualify as sleep apnea, because they base it on the number of apneas per hour on average, I needed to have a large sample of REM sleep, or else I wouldn't make the cutoff. And since REM sleep tends to happen more towards the later portions of sleep, you need to actually be able to sleep a fair bit, or be sleep deprived enough on REM sleep that your body is trying to catch up with it, in order for that kind of sleep apnea to show up in a sleep lab at all. I was very lucky that I just barely made the cutoff for qualifying as having sleep apnea. And I say I was very lucky because treatment has been very, very helpful. When I started getting my sleep apnea treatment, I was told that there were actually a variety of treatment options and that they would try to discuss which ones they thought would be best for me personally. They looked at my nose and my mouth and throat and discussed my needs and preferences and gave me different options about how I could try to treat my sleep apnea. This is really important because I've spoken to people where either they or their partner doesn't want to bother getting a sleep lab or trying to treat sleep apnea if they have it because they assume there is just one treatment for it that they'll be pushed into and they don't want that treatment. And I really want people to know that if you don't want a particular treatment, you can discuss other options. There probably will be other options for you. It's going to depend on your medical specifics, but don't go into it assuming you know what treatment path you will have. In my case, I ended up trying 3 different treatment paths. I got a dental device that would keep my mouth in a specific position while I slept, but that ended up not working out for me. It made my teeth hurt and then that would wake me up. And it just, my orthodontist tried to fix it for me and make it more comfortable, but it just got more uncomfortable over time. Like at first I would use it and it was fine, but as the weeks passed, it became less and less comfortable. I don't know why. I also got surgery on my nose, which was really, really helpful. My nose had actually been broken, so that's a medical issue. But apparently I also have genetically small upper nasal passages that they were able to widen. And this has made my day-to-day life so much nicer because I can breathe through my nose much more easily. I used to be stuck having to breathe primarily through my mouth, and that has so many downsides. I know this experience that apparently isn't common to other people, where you are going out to eat and you accidentally take too large a bite of food, and then you're desperately trying to chew it so that you can swallow it before you have to breathe again, and so that you're not choking, or else you're going to be like, I need to try to desperately gasp in a bit of air without anybody seeing my partially chewed food in my mouth. And that was a stressor throughout a large part of my life that apparently isn't supposed to be a stressor. So nose surgery, while not fun to have to go through, was really great. And then I got a CPAP, which is, of course, the most common treatment for sleep apnea. And now I generally have about 2 hours of better sleep efficiency. My sleep is still not refreshing. It's still not great. I still have delayed sleep phase syndrome, but I can be fine on about 9 hours in bed. And 2 extra hours per day is massive. It's just a huge quality of life change. And there's also the fact that untreated sleep apnea is really bad for health. It's hard on the heart, so you're risking heart disease progressively over time. It ruins your general health because your body uses sleep to, refresh itself. It's not great for your immune system. I remember one time when I had bronchitis and I was coughing so much I could barely sleep, and I finally got some codeine that stopped the coughing, and I got my first good night's sleep, and that was the turning point when I started getting better from that sickness. Good sleep is just really, really important. So I want people to know that it's really worth considering that you might have a sleep disorder if your sleep is really unrefreshing or inefficient. Or if you get a lot of nightmares, because sleep apnea can cause nightmares. And people who get nightmares often think, my sleep is bad because of anxiety, my sleep is bad because I get nightmares and so I don't want to sleep. And I know that happens to me. If I get a nightmare, I end up unconsciously sabotaging my sleep generally the next night. I try to stop myself, but it's really hard. But while there are obviously mental health reasons for anxiety and nightmares, and getting nightmares now and then is just normal for humans, if you're getting a lot of nightmares, it can be a symptom of sleep apnea, and having that treated is nice also because fewer nightmares. So really do consider talking to a sleep doctor, getting a sleep lab, discussing a variety of treatment options, and see if it might help you if you're in that situation. Because I know it helped me a whole lot. It didn't fix all my problems. I'm still really, really sick with a bunch of issues, but it was a big benefit. Anyway, that's my story. And if you liked it, please click like. And if you'd like more similar content, subscribe. If you know someone who might be interested in this video, then share it. And most of all, if you have any questions or similar experiences, I'd love to read your comments. Thank you.